Okay, Miss Valerie, you can have a seat. You look nice today. You just got off work?
No, I had a doctor's appointment and I just felt like dressing up because I don't get dressed much these days.
It's always nice to dress up, feel better about yourself.
I guess.
So what brings you in today?
Apparently I drink too much, maybe a little bit too much.
Mm-hmm.
My son was actually murdered about 3 months ago, and I've been drinking more since then.
Okay, so did you voluntarily come in here, or did somebody suggest you to come in here? How did that work?
Well, me and my husband were talking, and we kind of decided together that I probably should try to get some help.
Now, you say your son died about 3 months ago?
Yes, he was murdered.
He was murdered. Do you know who caused the murder, or is that case still?
Well, he was kind of involved in some things he shouldn't have been involved in, with, selling drugs.
Mm-hmm.
So, yeah, he was in the wrong place at the wrong time, and unfortunately, he was killed.
And how old was your son?
He was 21.
So since his death, you've been having a difficult time dealing with that and coping with it and agreeing with it. So you said the drinking has increased?
Yeah, I would say that it has increased.
Mm-hmm. So about how much do you drink daily?
Well, I can't say for sure.
Approximately, I mean, just give me a number. Is it a 6-pack? Is it a can a day? Is it?
Maybe it's more than a 6-pack a day.
Okay.
Yeah.
And so what does your husband think about you coming to treatment?
He just wants me to do, what's best for me, because he's tired of seeing me like this.
And when you say he's tired of seeing you like this, how is it that he's seeing you?
I just feel like I'm just very lethargic, like I don't have any motivation to do anything, like I don't have a purpose to live since my son was killed.
So you're having a difficult time in dealing with his death, and is your husband pretty supportive of, you dealing with that and you getting treatment?
Yeah, he's very supportive of me getting treatment. He wants me to get better because he said it feels like he's lost 2 people, not just one, because I'm not the same.
So it's probably hard with him dealing with that too.
Yeah, it is hard on him.
And is he getting any treatment as of now?
No, he's been, everybody handles grief differently. He's just been working and, trying to spend time with, family and close friends. But I know it's hard on him. That was his only son.
Okay, so why did you have to go to the doctor today? Was it just a checkup?
Yeah, it was just a routine checkup.
Okay. And are you currently working?
Yes, I work as a computer programmer for a private company here in town.
Okay. So you just program computers and?
Pretty much.
How long have you been in your job?
Oh, I've been there for about 15 years.
Oh, well, congratulations. That's good. So you got job stability, so you enjoy what you do?
Yeah, for the most part, I do.
Do you feel like your drinking has affected you in any way? I mean, I understand that it's affected you with just daily routine. Has it affected you with work?
Yeah, I can say that maybe my performance has suffered. Everyone knows that my son was killed, but so they cut me a little slack, but I couldn't say that. I do feel like if it weren't for that, I mean, I'm kind of using that as protection, I guess, for my poor work performance lately.
I understand. So maybe the people at your work, they don't know how to address it to you, or feel like you might not be ready to have that conversation yet. It is still probably pretty hurtful.
Yeah, I mean, I am still grieving, and I think they're looking at it that same way. So,
were you able to take any time off of work?
I took some time off, but I'm thinking maybe I came back too soon. I don't, it's hard for me to focus when I'm at work.
Okay. And your husband sent you here because he feels you have a problem with drinking?
Yes, and just grief as well. I mean, I don't know if y'all can address that here, but
Definitely. We can definitely give you the tools necessary to deal with grieving and coping with that as hard as that can be. Do you have any questions about what we do here as far as treatment? I mean, we give you the necessary tools in order to succeed. And you feel like alcohol is probably your primary drug of choice, because that's the main thing we're going to focus on is the substance use. Okay. And you want to stop that yourself as well, so you can focus better. Okay. Well, do you have any questions for me, Ms. Courtney?
No, I just, I want to know how long it's going to be before I feel like myself again.
That really depends on the length of treatment, and it can range from anywhere. It just depends on the person itself, of how much motivation you have. And, dealing with the loss of a child is definitely not a simple task. And we have counselors here to address the grief and the coping to help you kind of get through that, to make it day-to-day and you to feel a little better about accepting the death. And as far as the length of treatment, we can't really give you a guaranteed time, but we can give you an arrangement. Treatment normally lasts anywhere from 9 months to a year, but it depends on what stage you're in, so how much treatment you're going to need. And of course, we will have to assess you first. And after that, we will find out, your treatment plan, and you will discuss some of the things that you want to work on with us, and we will help you. And like you said, grieving is one of them. We definitely could help you with that. And the substance to help you focus better and work and just, go day-to-day living normal or however it was before, which is, of course, it's not going to be the same, but we'll try the best to help you with your needs. And, of course, if you want to bring your husband here, that's more than welcome, as long as you're comfortable. Did I answer your questions?
Yes, you did.
Okay, it was nice meeting you this morning.
Nice meeting you too.
All right, like to see you next week.
All right.
Okay.
Cut!